You're about to view an example of a simulated office oral. These 15-minute examinations are meant to evaluate the physician's abilities to establish effective relationships with their patients by using active communication skills. All simulated office orals represent office situations in which a physician plays the part of the patient. The role-playing physician is responsible for timing the examination, for providing prompts to help guide the candidate through the interview, and to introduce the presenting problems. A more extensive description of simulated office orals, as well as further resources for preparing for them, are available on our website at cfpc.ca and in the package provided with this video. The following case is about Ms. Margaret O'Brien, a 55-year-old woman who is consulting her new family physician, Dr. Cohen. Ms. O'Brien is concerned about her hypertension and would like Dr. Cohen's opinion of her osteoarthritis of the knee, which requires a surgical intervention. The college believes that physicians who use a patient-centered approach will better meet the needs of their patients. In the demonstration case that you are about to view, we have highlighted both strengths and weaknesses that might be observed in a typical candidate. Following the interview, we will review each component of the marking scheme and critically assess Dr. Cohen's performance.
The following video is an example of a simulated office oral examination. Some candidates may not have had an opportunity to observe or to participate in an examination of this nature. We hope that this video will help candidates to better understand the nature and purpose of the simulated office oral. The marking grid is provided to illustrate how simulated office orals are scored according to the patient-centered clinical method. In this example, the candidate's performance reveals diverse interviewing skills, showing both strong and weak elements. This will allow the viewer to gain a better understanding of what skills are being assessed and why. This video should, therefore, not be viewed as an example of a certificate-level interview or performance.
Hello, Ms. O'Brien. I'm Dr. Cohen. How can I help you today?
Well, I need to talk to you about my knee.
Okay.
Over the past 3 years, it's just been getting worse and worse. And I'm finding it very frustrating.
Is this your left knee?
Yes, the left knee, yes.
What's worse?
What's worse?
Yes.
The pain and the stiffness. And
Is it affecting any other joints?
well, no, it isn't. No.
Okay. So for 3 years, would you say it's getting progressively worse?
Yes,
Okay. How old are you today?
definitely. 55.
55.
Yes.
Okay. So not affecting any other joints. Have you hurt your knee somehow? Did you fall?
No, I never had nothing traumatic or anything like that. It just one day, 3 years ago, I noticed this slight pain in my knee, and it's gone from a slight pain to a bad
More of a
pain. Yes.
Okay. And you
So-
mentioned stiffness as well.
Yes.
When does that happen?
In the morning.
So when you wake up in the
Yes.
morning, you're stiffer, and as you get
Yes.
moving, it gets a little bit better?
Yes. Yes.
Okay. Is the pain there all the time, or it comes and goes?
It's there pretty well all the time now.
Okay.
But,
Worse when you're walking?
yes, activity seems to make it worse.
Stairs?
Awful.
Okay. And are you taking anything for this pain?
Yes, I'm taking Arthrotec.
Arthrotec? Okay.
Yes.
Is that helping?
Yes, it is. Yes, it's helping quite a bit.
Okay. Any side effects from the Arthrotec? Any abdominal problem? Any problems with your stools?
The only thing is that it seems to have affected my blood pressure a bit.
Okay. We'll get back to this.
Yes.
Any history of osteoarthritis in your family?
No.
Mother, father?
No.
Are they still around?
No, they're not. No, they're both gone now, but I don't think either of them had any of that trouble.
Okay. Do you have any siblings?
No.
No. Okay. So an only child?
Yes.
Okay. Do you take any other medication than the Arthrotec?
Well, I'm taking some hydrochlorothiazide now.
For your blood pressure?
Yes.
Okay. And how long have you been taking that?
I've been taking it 3 months.
3 months. And the Arthrotec, has that been 3 years or?
No, that's been 9 months now.
9 months. What were you using before, if anything?
Oh, I tried a lot of things. I started off with just ordinary Tylenol, and that sort of didn't work. I tried ibuprofen, glucosamide, did some physiotherapy. You know, I tried.
Okay. Now, did all these things work for a bit and then couldn't cope anymore?
Yes,
okay.
yes. And then, you know,
You needed to go to the next step.
Yes, I needed to go to the next step.
Okay.
And anyway, 9 months ago, I was so frustrated. I went to the doctor, my family doctor, Dr. Han, and she took an X-ray, and then it showed that indeed I had severe osteoarthritis, and in this knee.
Did they take a picture of the other one?
Some changes in this one, but
not there
I'm
yet.
not feeling anything there, thank goodness, yet.
Okay.
So, she sent me to
an orthopedic surgeon?
Orthopedic, yes.
Have you seen him yet?
Yes, I did.
And what did this doctor say?
I didn't see him for very long, but he told me that I'd need a new knee.
Okay, like an operation?
Yes, okay. He was quite straight about it, you know. He said that's what I'd need.
Okay, and how did you feel about that?
I don't know. I feel a bit confused.
Okay, scared?
Yes, and I think, you know, on one hand, it'd be good. I'd get a new knee, and I wouldn't, hopefully, have the pain.
Okay.
But on the other hand, you know, I'd be sort of dependent on people and not able to do things for a period of time.
Do you work right now?
No, I'm retired now.
Okay. Do you have a husband?
No, I have a different arrangement. I live with 2 women friends.
Okay.
We've known each other forever. We've been together for 25 years.
Okay.
We bought a house together.
Okay. And do you have any children?
Well, one of the friends was married.
Okay.
And she had a child. So we had a child in the house with us.
So
her husband and a child.
Okay.
And
is your husband still in the picture?
No, he died.
He died,
yes. But before I forget, I need to talk to you about the high blood pressure.
Yes.
Because I'm going to need a renewal for my prescription.
Okay. So the high blood pressure, you seem to say you've had it for 3 months.
Yes.
No history of high blood pressure before, and the doctor used to take your blood pressure and it was fine.
Yes, and then when I started taking the Arthrotec, after I think it was about 3 months later. Okay. Dr. Han took my blood pressure and it was up.
Okay. Do you remember the number?
I think it was something like 165 over 95 or something like that.
That's definitely up.
Yes, it was.
Okay. And has the water pill, the hydrochlorothiazide, we call it a water pill.
Yes.
Has that brought it back down to normal?
Yes. Well, it's now this was 3 weeks ago, 160 over 90.
That's
so
it?
Yeah, so it's coming down.
Okay. That's still a little bit high. Okay. Any other symptoms with the high blood pressure? Never had any heart problems?
No.
Any chest pains?
No.
Blurry vision?
No.
Headaches?
I wouldn't have known I had it.
Okay. So if it wasn't for the doctor, you wouldn't have known it?
No.
Okay.
No.
Okay. Do you know if there's any history of strokes in your family or high blood pressure in your family?
My father died of a stroke.
Your father, how old was he when he had the stroke?
He was 85.
85? Okay. And no heart problems in your family? Mother or father?
No.
No?
No.
Okay. You're otherwise healthy?
Yes, I'm very healthy.
So aside from those 2 medications, do you take anything else?
Well, I take some acetaminophen when I need it. That's the Tylenol when I need it.
For
the pain.
As an add-on to the Arthrotec?
Yes, yes.
And how often would you need to take one of those?
Well, not too often. Sometimes in the morning, you know, when
so
it's
on a
particularly...
daily basis?
No, not on a daily basis. I wouldn't say that.
Okay.
No.
Okay. Good. You were saying, I'm going to come back to something you said earlier. You were saying you had some worries about, being out of the loop for
Yes.
a little bit of time. You're living with 3 women who are healthy, or you
Yes, they're all
don't
healthy.
have to care
yes.
for them or anything like
No,
that?
no.
Okay. And are they aware of your problem?
Well, they know I have this sore bad knee. They know that.
Do they know you need to have an operation?
I haven't told them. No,
Okay.
no.
Do you want to have the operation?
Well, I was thinking in my confusion, as I told you, that it would be good. But then I think, well, maybe I could put it off. I mean,
Would you
what
want
do
to?
you think I should do about
Well,
this
would you want
arthritis
to?
while I'm waiting?
Would you want to put it off?
Oh, I don't know. What do you think?
Well, it's not really what I think. I can give you my opinion, but basically you're the one who has to live with the pain. How much pain are we talking about here? Is it tolerable? Is it intolerable?
Well, I say now with this medication, even though I have the high blood pressure, it's mostly tolerable.
Okay.
But sometimes it isn't.
Has it reduced your level of activity?
Yeah, I had to stop playing golf.
Okay. So it has reduced your level of activity and perhaps even your quality of life, right?
Yeah,
You would like to get back to these activities?
yeah.
Okay. Therefore, I think if you can have the operation, solve the problem in a more drastic manner, but still that would perhaps have you get off the medication, perhaps reverse your high blood pressure problem, and get you back into a normal life. Yes, there will be a period of adaptation right after the operation. You're not going to be, back to your activities right away. There's going to be some readaptation, some physiotherapy, perhaps a cane for a couple of weeks to a month. But very soon, I think, within the month, you'll be back to your normal activities and you'll be pain-free, which is the whole point of this operation, right?
I can play golf again.
Yes.
Yeah.
If you were good, was it worth it? But back to more serious things. The whole point of the operation is to get you back to your normal activities in a pain-free state and not to be dependent on medication for your pain control.
Yes.
Right? Because
Yes.
as you've seen, your medication you're taking is having side effects.
Yes.
Okay, your high
Yes.
blood pressure, which, we have to make sure that the high blood pressure is not just happen because of your age. People do develop high blood pressure with age. I see that, you're not obese, you have a good diet. Yes?
Yes,
You
I
take care
I
of
do.
yourself.
I'm in charge of cooking, so
You
I
don't
do.
smoke?
No.
Okay. Do you drink at all?
Wine with dinner.
Okay.
1 glass.
1 glass, okay. Never more than that? Or rarely?
No, very rarely.
Okay. So, if you have a fairly healthy lifestyle, your only impediment right now is this pain, which is slowing you in your tracks. You're not 85 years old, you're 55 years old. So, you have 30 plus years in front of you. What are you going to put off?
Right.
Do you understand?
Yes.
And if you're worried about, the people you live with, I think if you explain it to them, they will understand and they'll be supportive, right? You said you've been friends for 25 years.
Yes,
Friendships
I
like
know
this are very
I know
strong.
they'll be supportive. I guess I just didn't want to sort of let them down for a long while, so they were having to do more.
It won't be that long.
No.
It won't be that long. You'll spring back very quickly. When's the last time you would have seen your doctor in terms of your overall health?
Overall health?
Yes.
Oh,
Like
you
if
mean a
there's a-
complete checkup?
Yes,
Oh, that was a year ago.
that was a year ago.
Yes,
Okay.
but my doctor's not at all well at the moment. I don't even know whether she's coming back.
Okay.
So
I'm sorry to hear that.
Yeah, I'm very sorry. But so I may have to come back and see you again.
Okay, well, you're certainly welcome to come and see me. In terms of your apprehension to the operation, it's totally normal. Nobody likes to have an operation. But generally, when it comes to that, you need it, right?
You have 3 minutes more.
Thank you. So one of the things I would suggest to you is perhaps talk to people who have had the operation and see
Yes.
how they went through it. That would give you good insight into expectations about the operation. You need to maybe get in touch again with this orthopedic surgeon in terms of getting, because you said the visit was quite quick, to get
Yes.
more information about the operation. Like, as I said, speak to people who've had the operation. You need to speak to the women you live with at home.
Yes.
So they know what to expect. And you'll feel more comfortable to know that you can come home and some people are going to be there for you. You're not going to be on your own. Okay. You mentioned you needed refill for your blood pressure medication.
Yes,
I will
for the
certainly give you.
hydrochlorothiazide,
I'll
yes.
give you a refill. I'd like to measure your blood pressure today to make sure
All right.
it's not gone up even higher. I wouldn't mind getting a copy of that X-ray so I could, take a look at it. And if your family doctor is not going to be coming back, I certainly can take over your care. We'll just have the file transfer, organize a complete physical for you. Okay, this will get us a better chance to know each other, and we'll have everything up to date before your operation comes along, okay?
Yes.
Okay. So your blood pressure today, we're going to measure it, give you a prescription. If it's not low enough, we may have to change it or add another medication to get it back to a level that's
I see.
that's normal, okay? You don't
Right.
want to go to the operation with blood pressure that's too high.
Right.
Okay? Some
Yes.
of this high blood pressure may also be due, in part, to your anxiety towards having to have an operation.
Oh, I hadn't thought
so
of that.
if we can alleviate this anxiety, one, by talking together, talking to your the women you work with, you live with, and talking to other people who had the operation, make you feel a little bit more comfortable
Yes.
and less apprehensive about the operation, the whole process. If you know that everybody's ready for you and that you're ready, then it'll go that much
That
easier.
makes a lot of sense, yes.
Okay?
Yes. Thank you. Thank
You're
you. It's
welcome.
been very helpful. Thank you.
You're welcome. So just see my secretary on your way out and she can book you in for that appointment.
Right.
Okay?
Thank you, Dr. Cohen.
Good. Nice to meet you.
The Simulated Office Orals marking scheme is based on the patient-centered clinical method developed by the Centre for Studies in Family Medicine at the University of Western Ontario. There are 7 components to the marking scheme: the identification of the medical problems, the exploration of the patient's illness experience, the identification of the patient's social and developmental context, the candidate's ability to integrate the patient's context and her illness experience, the management plan, the candidate's ability to involve the patient in the management plan, a process known as finding common ground, and finally, the interview process and general organization. All simulated office orals deal with 2 major medical problems that require identification and management. In the case you have just viewed, Ms. O'Brien's first concern was her osteoarthritis of the knee. As you see, Dr. Cohen covered at least 50% of the points listed under each heading in bold in the left column. He would then be considered a superior certificate for the identification of the first problem. In the exploration of the illness experience, Dr. Cohen did an excellent job of exploring Ms. O'Brien's feelings, ideas, and impact on function, but did not seem to grasp well her expectations for this visit. For this reason, we will consider him a certificate in this area. Ms. O'Brien's second problem was her hypertension. Here, Dr. Cohen covers only one bullet under the section dealing with risk factors for cardiovascular disease. It is essential to inquire directly about diabetes or dyslipidemia in order to obtain those 2 points. As a result, Dr. Cohen will be considered non-certificate in the identification of the second problem. Under the illness experience, Dr. Cohen inquired sufficiently about her ideas and expectations. And will be considered certificant in this area. As we move on to the social and developmental context, Dr. Cohen will be considered non-certificant under the identification column, as he has only covered sections 1 and 2. However, he does a good job in reflecting back to Ms. O'Brien his understanding of her social context and its impact on her illness experience. He will be considered certificant for the integration of the context. Under management of the first problem, Dr. Cohen unfortunately only covers the first 2 points and will be considered non-certificant. He does, however, involve the patient in the discussion regarding her upcoming knee surgery, which is an essential part of his management plan. And will be considered certificant for finding common ground. For the second problem, Dr. Cohen is again considered non-certificant as he only covers the first 2 points. As there is little involvement of the patient in his plan, he would also be considered non-certificant in finding common ground. In the last section of the marking scheme, we will look at Dr. Cohen's overall interview process and organization. In general, the interview was well organized, with good integration of all interview components. At times, especially during the management phase, his style was somewhat rigid and directive, clearly pushing the physician's agenda and not exploring other options in the management of the patient's pain. We would assess his general performance at a certificant level.